Hello everyone, welcome back to the channel. In this video, we'll be discussing about the third chapter in surgery, which is trauma. In this lesson, the most important question is triage. For triage, we'll be writing answers in such a manner that first comes the tagging of the patient, then what are the two types, that is two systems in triage. Thirdly, we'll be writing about triage algorithm, and lastly a few points regarding the management. So now let's begin with triage tagging. Triage means to sort out. This is usually done in mass casualty events to prioritize the treatment. The tagging is done by color coding of the patient into red, yellow, green, and then comes the black one. What is this red color coding in triage? This red color coding is given to those patients who need highest priority and they would have sustained certain life-threatening injuries. These type of patients need immediate resuscitation or surgery in the next 6 hours. The 6 hours is very important and they may survive if timely medical intervention has been given to them. What are these injuries which are life-threatening? Such examples are tension pneumothorax, airway obstruction, hemothorax, cardiac tamponade, acute circulatory arrest, and major intra-abdominal bleed. All these examples come under highest priority injuries which are life-threatening to the patient. So those patients will be coded with red color coding. Then comes the yellow or the medium priority patients. They would have sustained serious injuries but they are not life-threatening. For these patients, possible resuscitation or surgery should be given by the next 24 hours. They are likely to survive if prompt treatment is given by 24 hours. What are the examples which come under serious non-life-threatening injuries? Like compound fracture, degloving injuries, pelvic fracture, the spinal injury, and the moderate head injury. So, the next color coding is green. Green has low priority. They will be wounded, the patients will be wounded, but still they can walk. That means they are ambulatory patients or who have sustained a minor illness. They are likely to survive even if the treatment is slightly delayed. For these patients, treatment can slightly be delayed. The examples for low priority injury are simple fractures and minor laceration. The last color coding is the black, which have least priority. That means the patient is pulseless and they are non-breathing. That means the patient is dead or moribund patients. The examples are severe brain injury, major damage or disruption to the chest wall and the abdominal structures. So the tagging in triage system are red, which is highest priority having life-threatening injury, yellow having medium priority, that is serious injuries but they are non-life-threatening. Then comes the green who have low priority and they are walking or wounded, and the black one is the least priority, that means they are pulseless and non-breathing. For each you have to tell how is the management done and what are the examples which come under these color coding. This is all about tagging in triage. The next one is triage systems. There are two types of systems in triage. One is multiple casualty and the next one is mass casualty. How is it different? In multiple casualty, into a hospital when many number of patients come, the staff and facilities are still sufficient or available to those multiple casualty. So the priority will be given only to those who have life-threatening injury. But in mass casualty, n number of casualties come to the hospital. That time, the staff and the facilities are not sufficient. So, the hospital management will prioritize those patients who have highest chance of survival. So, the priority are given to those who have highest chance of survival. In multiple casualty, to those who have life-threatening injury are given priority. In mass casualty, to those patients who have highest chance of survival are given priority. The third one is triage algorithm. This triage algorithm has 4 steps. 1, 2, 3 and 4. In the first step, we'll be assessing the physiological impact. Secondly, the anatomical state. Thirdly, the mechanism of injury. And at last, the history. What is there in the assessing the physiological activity? Here you will be measuring the vital signs and the level of consciousness by Glasgow Coma Scale, systolic blood pressure and the respiratory rate. Secondly, the assessing the anatomical state, you will check for all penetrating injuries, either to the head, the neck, thorax, any major burns, fracture or paralysis. Thirdly, you have to assess the mechanism of injury. Either it is due to falls, road traffic accident, crash or a blast injury, or a high energy injuries. Fourthly, you have to assess the history. What is the age of the patient, gender of the patient, any cardiac disease or respiratory disease the patient has, if the patient is pregnant, or the patient has any bleeding disorders or immunosuppressed individuals should be taken history. So the 4 steps in triage algorithm are assessing the physiological state, secondly the anatomical state, thirdly the mechanism of injury, and at last the history of the patient. This is about triage algorithm. Coming to the management in trauma is mainly the advanced trauma life support, that is ATLS. It has 4 basic steps in management. First one is the primary management. Secondly, you will be doing the investigations for the patient. Then comes the secondary survey, and at last the definitive care. I'll be dealing about this again in detail in ATLS protocol. Let us see this in brief here. In primary management, the most important thing is maintaining A, B, C, D, E and F. A comes for airway management. This is to assess the airway patency in the patient. This is done by using chin lift and jaw thrust maneuver. Nasal airway and oral airway are assessed. Then endotracheal intubation and tracheostomy should be done. For breathing, you have to give 100% oxygen in 15 liters per minute. Then you have to assess for the bilateral chest rise and breath sounds. Then you have to do pulse oximetry to check for SpO2. Then if there is any flail chest, pneumothorax, we have to treat that. ICD can be placed. Thirdly comes the circulation. Here you have to monitor the vitals, heart sounds and the ECG should be done to the patient. For shock, IV fluids, blood transfusion can be given. So you will be treating the shock or any external bleeds. You have to use 2 IV lines by 14 gauge or 16 gauge. How to remember these cannulas gauges? Just think of a plant which is planted in the soil. This orange color one is the soil. There are certain rocks above it. Then comes the plant stem which has a pink flower. Above that comes the blue sky and then at last the yellow sun. Now we'll mark the gauges. 14 gauge for orange, 16 gauge for grey, 18 gauge for green, 20 for pink, 22 for blue, 24 for yellow. This is how you remember the gauges in cannula system. Remember, the smaller the number, higher the diameter. When a patient is in shock, you need to rush the fluids. So you need to use a higher diameter cannula. So you will be preferring 14 or 16 gauge cannulas. Then comes D, which is for disability evaluation. GCS score and pupillary reaction are done for disability evaluation. E for exposure of the patient. Expose the patient for examining head to toe examination. Then at last comes the finger evaluation and Foley's catheterization for urine output. Secondly, the investigation. Certain investigations such as blood grouping, ABG analysis, radiological examinations like X-ray of the spine, chest, pelvis and extremities, CT scan if needed, ultrasound of the abdomen, and at last the serum electrolytes investigation must be done. Thirdly is the secondary survey, in which you will re-evaluate the patient again. And then at last comes the definitive care based on the problem of the patient or what the injury he has sustained. This is about management of a patient in trauma. The primary management, wherein you will be doing airway management, breathing, circulation, disability evaluation, exposure of the patient for head-to-toe examination, finger evaluation and Foley's catheterization. Secondly, the investigations, and at last comes the secondary survey and the definitive care. This is all about triage in trauma. Let us revise once. Initially, we saw what is tagging in triage. We color-coded the patient based on priority into red, yellow, green and black. Black being the least priority, who are dead or moribund patients. Then we saw about triage system, which is multiple casualty and mass casualty, wherein we saw based on the staff and facilities availability, whether you will be giving treatment for life-threatening or for those patients who have highest chance of survival. Then we saw triage algorithm, wherein we assess the physiological impact, assess anatomical state, mechanism of injury, and at last the history. Then we dealt with the management, which is primary management, investigation, secondary survey and the definitive care. Thank you for watching.